What's going on in patients with schizophrenia, bipolar, and depression? While we may not know all the details yet, science has made a lot of progress in understanding the biological basis of psychological disorders. I'm Sarah Tippett, and welcome to this MCAT Science Review video. You're going to hear about the biological basis of several psychological disorders, including schizophrenia, bipolar and depression, Alzheimer's disease, and Parkinson's. After a review of this content, you will be able to identify the biological basis of several common psychological and nervous system disorders, with the goal of being able to answer MCAT-style questions such as the one displayed on your screen, dealing with the role of dopamine. Let's dive right in with a look at schizophrenia. Like most psychological disorders, we don't know everything there is to know about what's going on in the body of a patient with schizophrenia. What we do know is that there's both a genetic factor and an environmental factor. Think of this as the nature versus nurture argument. Are you hearing voices because you inherited faulty genes, or is it because you were exposed to lead paint as a kid? As it turns out, both of these risk factors can contribute to neurodevelopmental abnormalities, which result in brain dysfunction and chemical imbalances, especially with the neurotransmitter dopamine, leading to symptoms of schizophrenia. Firstly, there's an association between genetics and schizophrenia. Specifically, first-degree relatives of schizophrenics have a 10 times higher risk of developing schizophrenia themselves. Trauma to the brain can contribute as well. Also, we know that high levels of dopamine play a central role. In fact, we treat schizophrenia by giving the patients drugs that block dopamine's effect in the brain, such as risperidone or olanzapine. Finally, we have observed structural changes in the brains of schizophrenics, though we are uncertain how this relates to the disease development. Let's move on into depression and bipolar. As you will see, there are many potentially contributing factors, making these diseases very complex and difficult to treat. In the case of depression, risk factors include genetics, lifestyle, issues with the amygdala and hippocampus, along with imbalances in serotonin, norepinephrine, dopamine, and cortisol. Many of these factors impact our treatment plan for patients. For instance, when choosing a medication to initiate, we typically ask a patient if they have a close family member who has used an antidepressant. If the family member was successful on a certain drug, it's likely the patient will subsequently respond favorably. On the other hand, bipolar disorder differs from depression in its risk factors and markers. While there's still a genetic link, patients with bipolar will have increased levels of norepinephrine and serotonin. And finally, patients with multiple sclerosis have a higher risk of developing bipolar. Most of us know someone who has suffered from Alzheimer's disease. It not only impacts the patient, but has a dramatic effect on any family members involved in the patient's care. Alzheimer's is most commonly seen in elderly women with a family history and low education level. There is a known link between genetics and Alzheimer's involving mutations in the presenilin genes, apolipoprotein E gene, and beta-amyloid precursor protein gene. This last risk factor explains the increased risk of developing Alzheimer's that's seen in Down syndrome patients. You should be able to recognize common biological markers of Alzheimer's disease on test day. It is common to see diffuse brain atrophy on a CT or MRI scan of a patient as displayed in this image on your screen. The brain on the right is a normal brain compared to the one on the left, which is a patient with Alzheimer's. Note the dark areas that show atrophy. You will also most likely see a flattening of the sulci in the cerebral cortex, enlarged cerebral ventricles, and deficient blood flow to the parietal lobes. Levels of acetylcholine and activity of choline acetyltransferase, the enzyme that produces acetylcholine, will be decreased. Along with these changes, you may find beta-amyloid plaques due to a misfold in the protein sheets, as well as evidence of neurofibrillary tangles and tau proteins, which are shown in magenta on the image on your screen. The last disease we will cover is Parkinson's. Parkinson's is characterized by abnormal movements. You can see in this image here a typical Parkinson's patient with stooped posture and shuffling gait. His face is also mask-like, and if you look closely at his hands, you'll see he's exhibiting pill-rolling tremor. Basically, it looks like he's rolling something between his thumb and finger. He may also exhibit cog-wheeling rigidity, which feels like jerking on exam. Chemically, you will find decreased dopamine production in the substantia nigra in patients with Parkinson's. This in turn impacts the basal ganglia, which play a large role in movement, hence all the movement issues. To compensate for this loss of dopamine, we give patients drugs that increase dopamine, such as carbidopa-levodopa. L-dopa is a precursor that is converted to dopamine once it enters the brain. Let's wrap things up by answering this MCAT question. The correct answer is C. Both Parkinson's disease and schizophrenia are characterized by abnormal levels of dopamine. You'll see elevated levels of dopamine in patients with schizophrenia and conversely decreased levels of dopamine in Parkinson's patients. The neurotransmitter involved in Alzheimer's disease is acetylcholine, not dopamine. Here are the key concepts you should know cold for test day. Schizophrenia is the result of brain dysfunction caused by both genetic and environmental factors. In patients with depression, you will see decreased levels of serotonin, norepinephrine, and dopamine, whereas in bipolar disorder, you will see increased levels of serotonin and norepinephrine. On a brain scan of an Alzheimer's patient, you will find many changes, including the buildup of amyloid plaques. And finally, Parkinson's is characterized by abnormal movement stemming from a decreased dopamine production in the brain. Great job on getting through that video. You should now feel more comfortable when faced with MCAT-style questions dealing with the biological basis of psychological disorders. Keep up the hard work!